deformities in children. Now let's move to question number 2. The green stick fracture is seen in option A, adult, option B, children, option C, at any age, option D, elderly. And answer is option B, children. Now let's move to question number 3. With fractures of the shaft of the long bones, rotation is controlled by option A, immobilizing the joint close to the fracture site in slight flexion, option B, immobilizing the joint close to the fracture site in neutral position, option C, immobilizing the joints above and below it, option D, surgery. And the answer is option C, immobilizing joints above and below it. Now let's move to question number 4. External fixation is used for option A, fracture with severe soft tissue injury involving skin and blood vessels, option B, unstable fracture, option C, pathological fracture, option D, multiple fracture. And the answer is option A, fracture with severe soft tissue injury involving skin and the blood vessels. Now let's move to question number 5. Burst fracture is seen in option A, talus fracture, option B, vertebral fracture, option C, femoral head fracture, option D, staphoid fracture. And the answer is option B, vertebral fracture. Now let's move to question number 6. Burn in electrotherapy occurs due to option A, overdose, option B, inability to dissipate heat due to peripheral vascular disease, option C, loss of sensation, option D, all of the above. And the answer is option D, all of the above. Now let's move to question number 7. The low frequency current is up to option A, 1000 Hz, option B, 50 Hz, option C, 100 Hz, option D, none of the above. And the answer is option A, 1000 Hz. Now let's move to question number 8. Russian current is option A, low frequency, option B, medium frequency, option C, high frequency, option D, none of the above. And the answer is option B, medium frequency. Now let's move to question number 9. Faraday current is option A, alternating current, option B, a direct current, option C, interrupted current, option D, modified current. And the answer is option C, interrupted current. Now let's move to question number 10. Dash current is used for stimulation of innervated muscle. Option A, Faraday current, option B, Faraday type, option C, surge Faraday, option D, interrupted galvanic. And the answer is option A, Faraday. Now let's move to question number 11. Head of the humerus measures almost half a sphere with an angular value. Option A, 180, option B, 160, option C, 150, option D, 120. And the answer is option C, 150. Now let's move to question number 12. Neck shaft angle of the humerus is option A, 45 degree, option B, 60 degree, option C, 90 degree, option D, 120 degree. And the answer is option A, 45 degree. Now let's move to question number 13. At rest, scapula makes an angle of about dash with the frontal plane. Option A, 15 degree, option B, 30 degree, option C, 45 degree, option D, 60 degree. And the answer is option B, 30 degree. Now let's move to question number 14. Scapulo-clavicular angle at the rest is about option A, 30 degree, option B, 45 degree, option C, 60 degree, option D, 90 degree. And the answer is option C, 60 degree. Now let's move to question number 15. Root of the spine of scapula corresponds to option A, T2, option B, T3, option C, T5, option D, T7. And the answer is option B, T3. Now let's move to question number 16. Glenohumeral joint capsule is lax to allow mobility. The head of the humerus can be distracted laterally about dash with the arm by the side. Option A, 2 cm, option B, 3 cm, option C, 4 cm, option D, 5 cm. And the answer is option A, 2 cm. Now let's move to question number 17. Dash checks the downward pull of the gravity on the arm by side. Option A, superior joint capsule, option B, rotator cuff, option C, glenohumeral ligament, option D, deltoid. And the answer is Option B, rotator cuff. Now let's move to question number 80. External rotation of the glenohumeral joint is checked by option A, middle glenohumeral ligament, option B, inferior glenohumeral ligament, option C, anterior coracohumeral ligament, option D, posterior coracohumeral ligament. And the answer is option B, inferior glenohumeral ligament. Now let's move to question number 19. Trapezoid ligament of acromioclavicular joint checks. Option A, medial movement of the clavicle. Option B, lateral movement of the clavicle. Option C, downward movement. Option D, upward movement. And the answer is option B, lateral movement of the clavicle. Now let's move to question number 20. Dash rotates the clavicle backward during elevation. Option A, upper trapezius. Option B, trapezoid ligament. Option C, conoid ligament. Option D, deltoid. And the answer is option C, conoid ligament. Now let's move to question number 21. Which stimulator is more comfortable, safe but less accurate? Option A, constant current. Option B, constant voltage. Option C, both. Option D, none of the above. And the answer is option B, constant voltage. Now let's move to question number 22. Pulses of tens are usually option A, uniphasic, option B, biphasic, option C, biphasic with even charge, option D, biphasic, even charge with equal or unequal pulse shape in both directions. And the answer is option D, biphasic, even charge with equal or unequal pulse shape in both directions. Now let's move to question number 23. Benefit of Russian current over Faraday stimulation is option A, better pain relieving effect. Option B, covers larger stimulation area. Option C, stimulation of deep muscles. Option D, better facilitator of healing. And the answer is option C, stimulation of deep muscles. Now let's move to question number 24. Rheobase is option A, maximum tolerable current for a nerve impulse at long duration. Option B, minimum current for a nerve impulse at short duration. Option C, minimum current for a nerve impulse at long duration. Option D, none of the above. And the answer is option C, minimum current for a nerve impulse at a long duration. Now let's move to question number 25. Which iontophoresis is used for hyperhidrosis? Option A, metallic silver. Option B, glycopyridium bromide. Option C, xanthine nicotinamide. Option D, vinic alkaloid. And the answer is